The story you are about to see is true. The names have been changed to protect the innocent.
Hey, Deborah.
Hey.
Hey, the PACU is on the phone for you to give you a report on the patient you have coming to room 3109.
Okay, thank you.
You're welcome.
This is Deborah.
Hi, I'm calling to give a report on Mr. Newhip.
Okay, just let me open his chart. Okay, go ahead.
Mr. Newhip is a 78-year-old man who had a fall at home and underwent a left hip hemianthroplasty today with Dr. Fix-A-Hip. He is alert and oriented ×3. His surgery went well and he has been relatively pain-free since he came out of the OR. He has a dressing to the left hip with no drainage and good pulses to both lower extremities. He is doing very well overall after his surgery. The only issue Mr. Newhip has had is his blood pressure become elevated after the case, running over 190s over 100s. We got an order on IV metoprolol and he received a one-time dose of that. His blood pressure is now stable. The last reading was 132/86.
Okay, great. I'll be ready for him to come to room 3109 whenever you bring him up. Thank you.
Hey, Deborah. How does your new patient sound that's coming up?
He sounds well overall. He had some hypertension issues, but they gave him a dose of IV metoprolol and it seems to have responded.
Okay, good. Well, when he gets to the floor, I can help you out if you need any help. Just let me know, okay?
Okay, great. Thanks.
All right.
Later that night, after the patient had arrived on the floor, things got a little busy for Deborah with her other patients, and she went to Courtney for help.
Hey, Courtney, do you mind giving Mr. Newhip his 10 o'clock medications for me? I'm really busy in 3107.
Sure. I'll pull up the NUR right now and I'll give him his medicines, okay?
Thank you so much.
No problem.
A few minutes later, Courtney was in Mr. Newhip's room with his medications.
Hi, Mr. Newhip. My name is Courtney, and I'm going to give you some of your nighttime medications. I'm going to give you your cholesterol medication. I'm going to give you a stool softener because sometimes those pain medicines can constipate you a little bit. I'm also going to give you some blood pressure medication since your blood pressure was a little bit elevated after your surgery.
Courtney thinks to herself,
Mr. Newhip has an IV metoprolol ordered on his MAR for 10 p.m., but it's a one-time order. He's not on a telemetry monitor, and that's a requirement when someone receives this medication through IV.
Courtney approaches Dee in the hallway.
Oh, God, this figure out. I'll be right back. Hang tight 1 second for me, okay? I'm going to go find Deborah out in the hallway. Hey, Deborah. Yeah. I was about to give Mr. Newhip his IV metoprolol and noticed that it was an IV dose and not a PO dose. He's not on a telemetry monitor. Also, his blood pressure is normal at this time, and this is a one-time order. Was this order already given in PACU?
Oh, yes, I forgot to tell you his nurse in PACU gave him that one-time IV metoprolol dose. I don't know why it's still on the bar. Maybe the medication wasn't scanned when she gave it?
Huh. Okay, well, I'm not going to give it to him right now since it looked like he may have already received it, but you should definitely call the PACU nurse and clarify if she gave it or not. And if she did give it, you need to make sure that she does document that on the MAR, okay?
Okay.
Here is a brief summary of the video you just saw. Deborah had received report from a nurse in PACU on a patient that was coming to the floor. In report, she was told by the PACU nurse that the patient she was receiving had gotten a one-time dose of IV metoprolol because their blood pressure readings had been very high after surgery. The patient was now stable and arrived to the floor where Deborah took over the patient's care. Later in the night, Deborah got very busy with another patient, and she asked Courtney, who is another RN on the floor, to medicate her patient with their evening medications. In doing this, Deborah delegated the responsibility of her patient's care to Courtney. When patient care is delegated, it is important that communication is provided clearly, for this involves a sharing of responsibility and accountability in patient care. Luckily, Courtney saw red flags before giving this patient the metoprolol that was scheduled on the MAR. This led her to question the medication, and when she did, she found out that the PACU nurse had already given the medication. Deborah had known this, but forgot to communicate to Courtney. For some reason, the PACU nurse did not scan the medication into the MAR, so there was little way for Courtney to be able to know that the medication was given. This situation was a near miss, but could have been a potentially devastating situation if this near miss had become an actual sentinel event. There are several communication issues present in this video. First, the PACU nurse communicated to Deborah, the receiving RN, that metoprolol had been given to the patient IV in PACU, but she didn't scan the medication onto the patient's MAR. Secondly, Deborah asked Courtney to give her 10 p.m. medications to Mr. Newhip, but Deborah forgot to tell Courtney that the metoprolol had already been given, resulting in a near-miss situation. How could this situation have been handled differently? There should have been more thorough communication and handoff between Deborah and Courtney when Courtney agreed to give Deborah's medications. The Joint Commission states that communication breakdowns are responsible for up to 65% of all sentinel events. Use of a standardized communication tool such as SBAR between caregivers at any patient handoff time, such as the one present in this video, can reduce medical errors and save lives.